psoriasis on the hands, is the most common form of this condition. Dermatologists note that the disease develops on the upper limbs in more than 85% of all patients. This disease does not pose a direct threat to the patient's life. However, it causes emotional instability, which can lead to the development of psychological complexes. It is important to remember that psoriasis on the hands is not contagious and cannot be transmitted through contact. The inflammatory process can begin spontaneously on any part of the hand. The symptoms of the condition appear as single reddish spots on the palms or between the fingers. The back of the hand is affected extremely rarely. In all cases, skin sensitivity is impaired, which causes significant discomfort, even when performing simple tasks. The initial stage of the condition is characterized by the appearance of small rashes on the hand and forearm, especially on the elbows. On top, they are covered with whitish scales that easily peel off. When scratching the itchy area, the number of dead epithelial cells increases. If you remove them, you can see a papule covered with the psoriatic film. The disease progresses with the appearance of new nodules that are different in size, merged together, and do not form large spots that are covered with a layer of husk. The following stages of psoriasis on the hands are distinguished. The first stage is exacerbation. This is the progressive stage of the disease. It is characterized by an increase in the number and size of patches, as well as intensified itching and flaking. The stationary stage. This stage is marked by a subsiding of the disease, a change in the color of psoriatic plaques, they become less red, and a reduction in the size of the patches. The remission stage is characterized by the complete disappearance of all signs of psoriasis. What creams and ointments can we use to treat psoriatic manifestations on the hands? Hand creams for psoriasis can be divided into two groups, or rather, not can be, but are divided into two groups. Hormonal creams suppress the immune response and reduce the intensity of metabolic processes in the affected skin cells. If these creams also contain vasoconstrictive substances, they become even more effective because when the medication acts on the skin, it reduces the concentration of nutrients and normalizes the process of skin exfoliation. Popular hormonal creams for treating psoriasis include products such as Triderm, Dermovate, Travacort, Elocom, and others. Non-hormonal creams have a pronounced moisturizing effect. Compared to hormonal creams, these creams do not cause dangerous side effects like hormonal ones do, and they do not disrupt hormonal balance. They are also more affordable in terms of cost. Popular creams in this category include products such as Sephora, Sorilum, and others. Regular baby creams with added chamomile, celandine, and calendula also work very well. They reduce inflammation, moisturize, and soften the affected skin. Among the popular ointments used to treat psoriasis on the fingers, hands, and palms are time-tested remedies such as naphthalene and actiol ointments. They have excellent antiseptic and anti-inflammatory properties. Sulfur salicylic ointment, these preparations, are used for the rapid healing of plaques. They effectively exfoliate dead areas of skin. Divonex ointment helps increase calcium levels in affected skin cells and dissolve psoriatic plaques. Acriderm ointment removes the horny layer and has strong antiseptic and keratolytic effects.